So throughout the different chapter, we've seen that myotonic dystrophy is a very complex disorder in terms of system involvement and impact in daily life. And Dr. Johnson, in your opinion, what will be the most impactful symptoms on the daily life of patients with myotonic dystrophy?
I mean, I think, we often recognize difficulty with their skeletal muscle system. So, difficulty using their hands, opening jars and bottles, walking, falls, but then also important to recognize, problems with daytime sleepiness and fatigue can be extremely debilitating. And so those often rank kind of one and two in terms of, symptomatic impact on patients' lives.
Thank you. And now, going back again to the complexity of the disease, Dr. Pesset, in your experience, how do we best help the patient and their family navigate this very complex disease, seeing multiple specialists, multidisciplinary team, and periods of intensive rehabilitation?
Yes, that's a good question and challenge in DM1. So this is coming back to the heterogeneity and the multi-organ and multi-specialist. So the first thing is that not every patient do have all manifestation and needs to see the complete list of specialists. So maybe one key lesson would be to have the appropriate infrastructure in some neuromuscular centers that do have the human and specialist resource. And the second message would be to tailor what would be the needs as regards to the patient profiles. So not all DM1 patients are the same, of course, and they don't have the same needs. So there would be some mandatory assessments that are of high prognostic value, like the respiratory and the cardiac, which is mandatory, I would say, for all patients, independently of the age. But then comes, and there will be huge differences in comparing the intellectual impairments in some kids as compared to normal processing patients. So recommendation would be really to adapt and to be very flexible in how to manage patients depending on what would be their needs. So we come back to identify the appropriate subgroups and the appropriate needs, patient by patient.
Thank you. Dr. Johnson, we talked briefly about the impact of central nervous system involvement, including executive function, hypersomnolence, fatigue, and apathy. How would you, what would be your lessons to help the general physician, the neurologist, to approach patients, so to make sure that they understand your recommendation, that they understand the importance of having a cardiac exam, for example, every year?
So I think I would certainly refer them to the Myotonic Dystrophy Foundation care guidelines and quick takeaways to kind of follow along in terms of ear management. But I think it's important, to use a system-based approach to ask the patient questions about problems with daytime sleepiness or difficulty thinking. And then, currently, individuals can use stimulants like modafinil or R-modafinil to manage the daytime sleepiness and hypersomnolence. And beyond that, I think it's a lot of adaptive function and supporting them in terms of their environment.
Thank you.